everybody, and welcome back to 5 on Friday, CEENTA's Facebook Live question and answer session. Joining us today is Dr. Roy Lewis, who practices in our Mooresville office. Thank you for joining us, Dr. Lewis.
My pleasure, Luke.
Today, Dr. Lewis is going to be answering questions about sinus infection and treatment. These questions were submitted by you through our Facebook page. Our first question was, what can I take to help me breathe at night while sleeping? My nasal passages stop up at night, and I wake up with dry mouth due to sleeping with my mouth open.
And so typically that means that you have enlarged turbinates. Turbinates hang down into the nasal cavity kind of like a tree limb. They get bigger and smaller. They were always big on our patients in Houston. Topical nasal steroid spray is very effective. The problem with that is it takes a good month before you really notice the benefit, and most people throw it away after about a week. But if you get something like Flonase or Nasacort, which are both sold over the counter, use it every day for a month, and if that's still not working, then come in and we can take care of it.
All right, great. Our next question is, when you have a secondary infection, do you always need an antibiotic?
And that's going to get a whole bunch of doctors arguing over that one. And my quick answer is no, you don't. Most of the time, if you keep some good saline spray going, your body is going to recover from the infection. Saline helps to rinse that away. I'd give it a good 7 days. 7 days in, you're still not getting better, then we head for an antibiotic.
All right, great. Our third question is, my little girl gets a lot of upper respiratory infections. Is she going to have sinus problems when she's older?
Most likely not. Little girl depends upon the age, and so typically 4 to 6 year old patients are going to have big tonsils and big adenoids, and the adenoids are going to shrink up over time. Usually around 12 or 13 years of age they will shrink up. Again, back to the topical nasal steroid spray. If you have a young patient that's having lots of infections, lots of upper respiratory tract infections, I'll beg for some saline spray, and I'll try to get them on something like a Flonase Nasacort as well. For a kid, it'll just be 1 squirt instead of 2 squirts. Give that a good month, but no, typically they're not going to have a lifetime of sinus infections.
Okay, great. We're next asked, I have a polyp on the sinus in the right side of my nose. Is surgery my only option?
And that's a fun question because it really depends what type of polyp do you have. So if you have something called an antrochoanal polyp, then yeah, surgery is the option. It's a great option. I love antrochoanal polyps because you take them out and they don't come back and the patients feel great. If the polyp is more of an inflammatory polyp, then a lot of times surgery is not the best option. We're going to treat your allergies and keep you on nose sprays and keep you on maintenance. So really, again, it depends on what type of polyp you have. The CT scan that your doctor did will give you some really good information as far as what type of polyp it is.
Okay, and our last question is, how do I know if I have a sinus infection or just really bad allergies?
Duration is the quick answer on that. And so if you have a sinus infection, usually it's going to run its course a good 1 to 2 weeks. You'll have pressure, pain, purulent, yellowish drainage. Teeth may hurt, you have a bad taste, bad smell, and generally you feel run down. Allergies, I call my allergies my walking wounded patients. They go to work, they go to school, they're stuffy. One of my patients described it as I have a cold all year long. That's allergies, and we can do over-the-counter medications such as the Flonase and Nasacort. If those are not effective and you're also adding in antihistamines, then we proceed to testing you. We do a skin test to find out what you're allergic to, identify what your allergies are, and then treat those allergies. Duration is, again, the quick answer between the two.
Okay, great. That's all the time we have today for 5 on Friday. Again, I'd like to thank you, Dr. Lewis, for joining us. And if we didn't get to your question or you asked a question during the live session, we will be answering that in a follow-up blog on our website. Keep an eye on our social media for a link to that blog and to this video. If you'd like to make an appointment with Dr. Lewis or any of our ENT doctors, call 704-295-3000 or visit our website at wejustmakesense.com. Thank you for joining us, and we'll talk to you again soon.